Welcome. My name is Maria Papitas, and I'm with the University of Delaware Cooperative Extension. And with me today for this presentation is Jesse Ketterman, who is with University of Maryland Extension, and Paul Goenringer, and he is with the Ag Law Center with the University of Maryland. And I am going to share my screen and get us going here. So welcome. As I said, I'm Maria Papitas, and today's program is health insurance options for farmers, small business owners, to cover themselves, their families, and even their employees. And this program is brought to you by the University of Maryland Extension and the University of Delaware Cooperative Extension. And it is, we are open to everyone and welcome everyone. It is also funded through the Northeast Center for Risk Management Education Center. So we're very pleased to have their support to do this initiative. I kind of introduced ourselves already, so I'm going to skip this slide, but there are our emails. All right, so for our plan for today is really to know important insurance options related to small businesses and farm operations, to identify items to consider when selecting insurance, to know where to go for information about insurance options. Oops, excuse me. And we'll be sharing a lot of resources with you so that as you kind of consult with your financial professionals, you can ask them the right questions and feel confident that you're getting good information. So we kind of organize our information in this way, right? Key questions that you want to have answered. And so we start with why. Why does my farm operation need to plan for health care coverage? What, and that is, what are the health insurance options and what are some resources that you might use that can provide information about those options? And lastly, how do I choose a plan or operationalize this for my business? So we're going to go through all of those questions today. And by the end, you'll be able to make a smart choice about health insurance options for you and your family, your employees, or your operation. So I'm going to start with, why does my farm potentially need healthcare coverage? And you can put some of your answers in the chat if you'd like. And we'll also kind of go over them as we go. So one of the ones that we came up with was to ensure you and your employees have coverage needed to keep everyone well. And what we know is the people on your farm, your family, your employees, you all are the most important assets that your farm has. And so there are many risks. We know that farming is a very dangerous profession. And so it's important to be sure that your folks can stay well. And because we know that health care can be costly, and health insurance is one of the ways to help offset some of those costs. So another reason to have health coverage is to really understand the benefits from your health insurance coverage. And again, this is related to staying well, but one of the important things to recognize is, insurance providers have negotiated rates with healthcare service providers, and oftentimes you'll pay less if you have health insurance than if you pay a provider directly. So understanding the plans are really important so that you can get the best coverage and pay the least amount for it. Another is really to protect you and your employees financially from an unexpected health issue. As I mentioned, farming can be really dangerous. And so, and health insurance costs could be a major part of your spending plan as an individual or a family. And so being prepared and staying healthy are steps you can take, but also having that health insurance can help offset some of those costs. And so you can use kind of tax advantage savings tools like a health savings account. And we'll talk a little bit more about what that is in a few minutes. But it's important to kind of have an understanding of those tools that can help you use your money wisely. It's also really important to understand the types of insurance options that are available to you for your situation, whether you're trying to just cover yourself and your family, or maybe yourself and your employees. Understanding those options, we're going to talk a bit about that today. And then the other piece that's key is this idea of, having a sense of how much out-of-pocket costs can be. And by that, I mean, those are the costs that we have to pay out of pocket before the insurance kicks in, or in addition to the insurance helping to cover costs. So by kind of having a sense of what those out-of-pocket costs, estimating them, and then saving for those, that can really help reduce the stress about covering healthcare costs. So for all of these reasons, understanding and reviewing costs and health insurance plans are an important start to being a smart chooser and user of health insurance. Oh, and lastly, it's this idea of we know from the research that many young people especially are looking for benefits as part of their reimbursement, their participation in a place of employment. And more, they're choosing places that offer benefits as opposed to places that offer benefits. And so the research is really saying that benefits are a way to help retain employees. And we know that that is also one of the stressors for many farmers, is not being able to find the right people and then being able to keep the people. So when we talk about health insurance benefits, there are a set of 10 categories of services that health insurance plans must cover at some level under the Affordable Care Act. And so I'm just going to put all these up on here and quickly go through them. So at some level, all health insurance plans must cover these 10 things. So you can see preventative and wellness services. So that might be, for example, your annual checkup with your doctor, or your annual GYN appointment, and kind of those wellness services that support you preventing illness. Other things that must be covered are things like lab tests, hospitalization, prescription drugs, services and devices that help support recovery from injuries or disabilities or other chronic conditions. Outpatient care, so that's like, when you go to someplace and say an urgent care, for example, or a place for surgery and you're released the same day, right? That's outpatient care. Maternity and newborn care, mental and behavioral health treatment. So, pediatric care and emergency room services. So those are the 10 areas. And Some plans also cover more services in addition to these, and some plans actually offer dental care coverage for children. But dental plans for adults are optional. And so specifically, what level of care may vary from state to state. But when you compare the plans, you'll be able to see what's covered and what's not, and by how much.